and type in those questions now. Roland, I think the 90% retention rate is something to be congratulated about. I know many of our teams are working on the mother-baby pair retention, and the fact that you are showing that it is being sustained is really exciting. Obviously not without challenges that you just mentioned on sustaining the level of intensity and the sheer volume of the workload of the community health workers. But I think it's huge kudos to your team. There's also obviously the great promise for the PNC visits to continue, as we're seeing the last couple months over 80%. So just huge congratulations to the teams. I was just wondering, have you guys thought about working with the community leaders as well to ask them what their ideas are to sustain the work? If similar to what Luke and his team is doing, how do you get the community involved to come up with ideas on sustaining the community outreach in addition to what's happening at the facility level?
Thank you for that question, Patty. First of all, the people that are selected as community volunteers, we are engaging the community leaders upon selection. So when they were selected as home-based care providers, the community leaders were involved, and when we brought up the idea of introducing this MNCH component, together with the council health management team, we involved the community leaders around these facilities to identify who of the home-based care providers, because there are actually a little bit more home-based care providers than these MNCH workers, to identify the right people that would have the commitment to offer these services. The other aspect is actually what also Luke was presenting. We started our PHFS project with